Everybody has been using the power strap for many days or months or years. So I think some of you all might be having more practical experience than me. Okay. Anyway, I have been in this PCM for more than 25 years. Briefly, I will just talk some background about PCM in Singapore. To be an acupuncturist in Singapore, right now you need to be an integrated PCM physician. Okay, that means you have to go through a PCM course in Singapore or the recognized university from China. Then you can be an acupuncturist. So now previously before the year 2000. Anyone who wish to learn acupuncture can learn from some institute and get licensed as an acupuncturist. But today, no, because I used to come across a lot of pressure from some other country. So say they want to come and learn and come and register as acupuncturist. So the answer is no right now, because every country has their own different background. I understand from Italy, you need to be a surgeon, medical surgeon, then you can practice acupuncture. So you are PCM physician, you can. By the way, in Singapore, we are called PCM physician, not doctor. We cannot call ourselves doctor. But in China or other places, people used to call us doctor. So there are some distinction, because in Singapore, you have this Western medical practitioner, and you have the TCM, and unfortunately in the year 2000, the Singapore government recognized PCM as a way of medical system, and we were registered. So currently, if anyone not registered with a license, you cannot practice. But anyway, it's okay. For what I'm trying to talk about, meridian points, or is an point. You need not to be a physician to know that, because you can do acupressure, you can do any other things that you learn all this. By the way, if we are going to talk about this meridian acupuncture, you take many years to learn, because in fact up to today we are still learning also. Next 2 weeks later, I'm going to China again to learn some new skill. Okay? So we are learning progressively, and we are here using 2 hours to go through some basics. So I can give you a very brief. So if any question, you can just ask me. It's okay. Before I go into the meridian acupuncture point of this, I have to talk about PCM, because it's a different philosophy and a different point platform compared to the Western medical system. So when we talk about how we treat patients, all this, usually the Western medical side, they cannot reconcile with us, because the philosophy is different, the platform, the belief is different. So basically, I'm going to start with this PCM traditional Chinese medicine. Actually, it's a comprehensive medical system derived from China 3,000 ago. Some people say about 2,000, some people say 5,000 years ago. So this system is developed and practiced, and from the experience right now previously right now in the oracle, the turtle shell, all this there are some codes, all this. So from there, people come up with a comprehensive records of this PCM. Basically, there are 2 outstanding feature in PCM. What we call is holistic point of view. Holistic means when you look at a person, you look at the whole. It's not saying when you having a headache, headache, you treat your head. If you got headache, it could be due to your stomach problem, for maybe menstrual problem or whatever, different. So we have to go to the root cause. So this is called holistic approach. Then the second part is very important, called application of treatment according to differentiation of symptoms. Okay, anybody understand what's the different symptoms? Basically, in TSM philosophy, we our body, we have 9 types of body conditions. So everybody is different. So when you look at someone, that someone is different from your friend. So the similar problem, so when you apply even acupuncture or Chinese medicine, your prescription and her prescription could be different because of different body condition. So we call the application of treatment according to different syndromes. Something like heat, PT, or cool, all these are which the medical science, they don't believe where got heat, where got, when you go to the doctor, the Western doctor in Thailand say, oh, you are hippie, everything. What's hippie? They don't believe, but through your experience and others' experience, you have this problem. If you eat a lot of durians, you will turn out to be hippie, or sore throat, feel warm, all this. So that's called energy, actually. Energy accumulates in your body. You cannot release in time. So you come to the stage that you have this hippiness. So the next one. Then we touch briefly about the philosophy. Yin and Yang. Okay, everybody know what's Yin and Yang? This logo is a symbol. Some people thought it's superstitious. It's not. It's a sign. It's a sign of both sides. You have positive, you have negative. So that's called Yin Yang. Right? Man, female is called Yin Yang. Day and night is called Yin Yang. Okay? So you have different. For our body, we have this plus and minus energy, right? Electronics phenomena. We have so this is called Yin Yang. Plus and minus is called Yin Yang. Okay, and 5 elements. Anybody knows what's a 5 element? 5 element. Wu Xing, the Chinese word Wu Xing is a 5. It's a characteristic. It's a generalization of observation through few thousand years ago that the Chinese classify all this condition according to the what we live environment and how it relate to our body. They classify it into 5 aspects. So every aspect there is a classification. And okay, Chanfu, when you hear about Chanfu, that means it is a Mandarin word, organs. Okay. Then you have this Qi, blood, body fluid. Qi, what is Qi? Qi is like your energy. So sometimes, in Chinese you say, oh, you don't have Qi. It means you are very weak. You run for 20 meters, you cannot run. So we call no energy, no Qi. Okay? So that is very important because the Qi will lead the blood, the flow. And of course, blood is talking about normal blood container body. Then body fluid. Body fluid, actually, everything which is liquid, relate to this body fluid, saliva, all this. So these are concepts I will first. Then come to the important one, it's called the channel and collaterals. Okay, channels and collaterals, all meridians. Okay, then 6 so channels factor, that means 6 external factors. When a person gets into sickness, so partly is because of the environment. So environment, there are 6 aspects. Okay. Next one. Okay. The theory of Yin Yang say this way: human body is an organic whole, which is divided into opposite aspects. That's why I roughly explained already. Yin Yang. The disease is the result of the imbalance. So that's someone asked me also how to maintain the body. I said you maintain the yin and yang. How to maintain that? You go into details also. Then the goal of clinical treatment is to restore the imbalance of yin and yang. So that means when your body you cannot be too heaty, you cannot be too cold. Okay, very simple example. If you stand at the seaside the whole night, like a wind blow, right? That is coldness. So your yin yang will be imbalanced. The next day what happens? You get sick already. You have high fever, you have flu. Right? So then we talk about 5 elements. Okay? You can see fire, earth, metal, water, wood. Okay, these are the 5 categories. Wu Xing. Then in the Chinese culture, people use these 5 elements to do about what? astrology or what, calculate your destiny, all this stuff. So, misperception again, say, oh, PCM is superstitious. It's not, okay? This is a science as well. See, what is the main important thing? Important part of this 5 element is talk about in this system, this world, or your human life, there's something called the generation, the growth. You see, in our human history, we grow, we produce, baby, grow. However, there must be something which can control. They call subjugation. So, 相生相克 in Chinese, some will understand Chinese. So you need to have some growth, you need to have some control. If the growth is continuously without stopping, then it's a disaster. That's like human race. You have more population growing, then one day, what is the problem? No problem. So you have disease, you have nature, death, all this. So these are the things that it affects our daily life. Okay? So these are the 5 basic elements, and they are instant, constantly changes. So this is just a diagram. I'm not going to go into too detail, but I'm trying to say this 5 elements relate to our body. Okay? When we talk about environment, so in Chinese we call it the universal 大宇宙. When our body, our body we call it 小宇宙, the small universe. See? So that's why in Christian philosophy, a person is closely related to the environment. Okay? So you have seen heart, fire represent the heart, then earth is spring, then the lung water is kidney, wood is liver. Just for example, how sickness occur? You see here, the liver can, okay, woods, we call woods can affect the earth. Try to understand because it's like a bit abstract. In Chinese we call 木饭土. That means the woods and elements if too much, that will affect the earth element. You just think about the environment. You will have a place full of forests, all things, and that will affect the environment. If the place is less vegetation and you see people doing chopping of the trees, all this, then you cause a lot of landslide, all this. So it will affect. Similar to the body, when we talk about woods, it's our liver, okay? The earth is our stomach. So you see, when a person having some liver problem, the stomach will have symptoms, stomach ache, you have gallbladder stone or something that you have diarrhea, you have stomach ache, all this. So this is the concept. Okay, these are true experience. They come with it. In the next one. Okay, this is a part where PCM reckons how we work in our body. We have the 5 organs. Okay, what are the organs? Okay, one is the heart, then the pericardium, then we have the lung, we have spleen, we have liver, kidney, uterus. Okay, these are the 5 chakras. Then we have the 6 organs. Gallbladder, stomach, small intestine, large intestine, big bladder, and subject. What is subject? Everybody ask me. Actually, it's a concept. So like, it's 3 parts of our body: upper, central, and middle part. So it's subject. So 3 parts of our body: upper, central, and middle. It's a generalization, or it's external factor. Okay. That's something about the organs. You notice that the TCM only talk about heart, and where's the brain? No brain. The ancient Chinese, they don't reckon brain to it. But Chinese culture say, when you think, when you do some thoughts and some thinking, you don't just use your brain, you use your heart. So that's heart. Okay. Then we come to this part, called qi, heart, body fluid. The qi, what is the qi? Qi is the energy, but that's how I mentioned. Then we talk about 6 external factors: wind, cold, summer heat, dampness, dryness, and fire heat. So these are the factors which will affect a person. Okay. When you, that's how I say, you set the roadside, seaside, overnight. So with the wind blow, then the process. So you cold, you go to a winter country, you don't wear enough clothes, you get sick or so, right? Then too heaty, dampness. In our Southeast Asia, we have this dampness. We will easily get, Chinese will say the feng shui, you got joint pain, all this. Weather forecast, when it's going to rain, you feel pain. You see, there are a lot, anyone or relative experience this sort of thing. When weather's change, you feel body ache, all this. Dryness, then sore throat, then fire heat. You find different fire heat, this very heaty. So before I go further, by the way, have anyone here learned about meridian before? Anybody? Nobody. Meridian. Okay. So you can buy some books and sell it at meridian, because it's very complicated. Basically, there are 365 points, but up to today, when they developed, we find out actually 1,000 over points. So there are 12. These are called the meridian and acupuncture points. Okay, this is something very abstract. This has led to a lot of arguments. So people, the scientists will ask, what is the point? Where is the meridian? Show me. You can't show me. You see, I explained to you just a pathway. This is called pathway. Okay, you look at these are series of connecting pathways through which qi and flow circulate. The physician believes that through this pathway, the person's energy will connect, will enhance. If any point of this is blocked, then you have imbalance of your health, you will have sickness. So the passage through which blood and qi flow and nourish the yin and yang, and to moisten the tendon and bone. So this is very important. So when there's so-called blockage of energy, then will affect your development of your tendon, your bone, and the pathway to which the external factors are transmitted. Also, through these channels, meridian, you can get signals. Okay? So these are things. Let me elaborate a bit. You see all these lines and points. I used to explain to people. You just think of the MRT in Singapore, MRT, the Eastern Line. Then the acupoint, what is acupoint? Acupoint is something like a station. Okay, Dhoby Ghaut. So now from Dhoby Ghaut, you want to go to Changi Airport. So you need to transfer or something like that. So that means when we want to do some treatment to the head, so not necessarily you use your power strip to place on the head. You can place on the hand here. So it will travel. They'll bring you to Changi Airport, something like that. Okay? So you understand roughly the point. So why, when acupuncturists put needle resistance to someone, so when you have headaches, sometimes they don't insert or not. They just do on your leg, your hand. Okay? Because we have a look at different conditions. So by doing that, that transmission can go to your head and resolve the problem. So that's one of the points. Understand any question, any misunderstanding or what? So these are the things. Okay. The next one. Okay, this is just general knowledge also. The PCM believes that the 12 meridians, we have this 12 meridian. It looks 24 hours, the energy flow in our body. So at different times, the energy flow will go to a specific meridian. For example, the lung meridian, 3 a.m. to 5 a.m. That is the force of the energy flowing through that meridian. That's the lung meridian. Okay, that's why we were saying that some people cough badly in the night between this hour. So does it mean that when you want to do treatment, you ask the patient to come at 3 a.m. or 5 a.m.? It's not practical. It's not practical. However, I was thinking that like these power strips, based on it, when it works well at 3 to 5 p.m. So how long you put on your strip? 48 hours or 24 hours, right? So it will deliver that function during the time. Of course, the normal time, because it's flowing all the while. However, at this specific time, it has specific function, specific usage. Okay, so this is also for the guideline. So the next one. Come back a bit about acupuncture. It's older, most commonly used medical procedure originating from China more than 2,000 years ago. So the acupuncture technique has been most studied usually involve manipulating the skin with thin solid metallic needles that are manipulated by the hands or by electrical stimulation. So for acupuncture, actually it began to become famous, well known during the 1971 when New York Times reporter James Reston wrote about how Dr. China used needle to ease the pain after surgery. Okay, I think this is one of the visits during the President Nixon. He visited China. The first time they opened up the door of China and have built up the relationship with China and US. So when President Nixon was there, so they have performed something called anesthetic acupuncture, whereby the patient was doing a surgery and without anesthetic. Actually, they have some local anesthetic. Then with the acupuncture manipulation, so it numb the area. So when the person is having a full conscious, so they need an operation for that patient. You see? So of course, later there are a lot of people talking about negative comments, say, oh, it's love, it's engine, or it's not. It's true. Okay? If you know how to manipulate properly, okay, it can have anesthetic effects. Okay? That's why when we talk about acupuncture, the pain relief comes in. Someone on back pain, backaches. So when you do this acupuncture, it will help you. Okay? Or you don't use needle, then use acupressure. You don't use acupressure, then use strap. Okay? So this a lot of alternative ways. Okay? And then people ask. I used to ask my professor always also. A lot of people disturb us. They say, where is your proof? Where is your evidence-based acupuncture? My professor replied me in that way, saying, okay, the scientific aspect, let the scientists verify it out. A lot of things we can't tell. However, concentrate on your efficacy. That means you have 100% with this backing or headache, you do your manipulation, and when it improves, it has a clinical result. Then you are doing something is good, for patient. And how to know right now with our knowledge, we cannot know first of chicken or first of egg. It's an issue that very hard for us to know. I always think of something, when scientists or those so-called smart guys one question about all this. I was thinking a lot of things in this world environment we can't explain, very hard to explain. I was trying to look at jellyfish. Jellyfish, they have no brains, right? They have 23 eyes or 23 pair of eyes. But they have no nervous system, but they have no brain. But how they function, how they move around, how they going to catch a prey, how they to go in a group. So these are something that is, as human beings, we still don't know, we still research. So similarly for this meridian things, a lot of things we are still finding out. Okay, we talk about how it works. First of all, we talk about balance of yin and yang. When your body is not function well, not balanced, so by doing some manipulation, it can balance the equilibrium, right? Balance the body. So this is one thing. Then regulate the nervous system. When you do something, okay, acute point is not on the nerve. Meridian is not on the nerve. If it's not on the nerve, when we very quick, it will damage your nerve, right? So it's something quite near to the nervous system, quite near to the capillary blood system. So it's not. So then it regulates the nervous system. It will alter the brain chemistry. Okay, this has been done quite a lot of research. When you do some part of the herb, you know this herb L-I-4. It's this part. Your brain will secrete something called hormones. Endorphin. Yeah? I don't know. Chemical. Yeah. We will have something to numb the cell. So this is one thing. Then other theories, there are people talking control theory. That means you have headache, then press your hand. So your hand feel pain, your feet will feel so pain. So this is all gate theory. They open different gateways. Then electronic theory of pain. The body continuously generates tiny detectable electrical impulse and shots. So that this acupuncture point are concentrated in the region below electrical resistance. These are some of the research people tell me how it works. Then it has proven that some of the big universities in China have done this way. Then they have done some research. Those points like I4, S36, all this one, you have different response throughout the body. So they have done a lot of this research on this. So what I'm going to summarize is acupuncture has shown to stimulate the immune system, also has an effect on circulation, blood pressure, rhythm, stroke, volume, and heart. Okay, gastric acid, production of red white cell, also stimulate the release of a variety of hormones that help body to respond to injury and stress. Okay, one of my professors in China, they have done a clinical testing that how to show the immune system works. So they take blood counting before and after. So you have a group of 50%. Before that, you change the blood count. Then after that, you do some manipulation. Then you discover, the T cell, B cell, the white blood cell is acting, become more. So let's explain how it fights against virus. So for acupuncture, actually, it is not only to kill the pain, to treat the pain. It also can help you to relieve your fever, can cure fever, running nose, many types. Okay, the World Health Organization has recognized, confirmed that there are 44 types of sickness which can use acupuncture to treat effectively. So these are the things: infection, you can cold, flu, bronchitis, asthma, arthritis, back pain, headache, stroke, deafness, eyesight, eczema, skin problem, acne, all it. Okay, we have patients, they have experience treating the skin problem. That's why the school of thought called the aesthetic acupuncture. So those I think can make a lot of money aesthetic because people come and they don't take medicine, they just do needle on the face. Okay, and also some of the system, the stomach meridian. Because when a person has this acne, skin problem, some usually it's because of the internal system not clear, not doing well. So you have to manipulate, you have to clear the system as well. Okay? So these are some of the things that it is true. Okay? Again, this is a summary of acupuncture. Just now we talked about yin and yang, right? The yin yang is the hot side, heat side. Yin is the cool side. Okay? You have the lung, meridian, you have the pericardium, you have the heart, channel, and hands. Okay, the yang side you have the colon, that we call intestine. Then you have the sun xiao, the small intestine. Okay, this is yin yang. Next slide, please. On the legs channel, you have the kidney channel, you have liver, you have spleen, that's back the knee. Then in young, you have the urinary bladder, gallbladder, stomach channel. Next slide, please. These are the two. When I talk about 12 meridian, right? But actually, meridian, there are a lot. The main one is 12. So this is extra 2, called the ren and the 2. Okay. What is ren? The English code is called as CD, Central Versal. The 2 is a double GB behind. Okay. It's a central line. So for those who learn Qigong, energy, Tai Chi, Qigong, all this, then you need to know this, because it's when you do some breathing, then you imagine that the energy goes through your 2 mind, and then 3 mind, 4 mind, 2 mind, all this. 小周天、大周天, every 1 third of that. So those anyone practice Tai Chi here? Qigong? Nobody, So okay, never mind. You can try to. Actually, Tai Chi is very interesting. You can try to ease a lot of pain. Okay, because of movement. Now we come to we have 12 meridian plus 2. So briefly, try to understand, try to remember, because it's very hard to remember. And when we talk about English translation, it's very funny, when we talk about this TCI thing in Chinese, because there's no the best written Chinese translation. So when we talk about Zhongfu, we talk about Lang channel, you might be a bit confused. Okay? But what you need to know is that after that, I will give you the 12 type of common disease. So go back and you know how to treat 12 types of sickness already. Then you want to learn more some other times. 12 types is more than enough. Because I select the most common one. So what are the points you use common? Actually, not necessarily those points. I just generalize. So you can try and error also. Okay? Because through our experience, through our treatment in the patient, we found that a lot of points which is good to tell something like certain point is not recorded in the books, but when we try to do it, then the other type of sickness disappear, the other type of sickness like backache, so we touch on some points which is not recommended, but when we try a few times, it works on that, so we write down, then we invent. Next time we can write the books. So how things develop is like that. So for you all, the same thing, you all use yourself, you all ask your friend or the client to use, so get the feedback. For asthma, this lung, not only lung, some other place also work for a few cases. Then you can